There's a lot been happening in the UK over the last 18 months, but I think I'm going to try to convince you that if health systems internationally are going to be sustainable, then we will need interdisciplinary collaboration at scale. Secondly, I think we need to see a convergence of care and research. And to achieve that, I firmly believe that we need data linkage and analytics increasingly in real time. But we're very proud of our health service. It's a singular service. It looks after 60 million people, and it's a rich source of data. So that was 1948. In the same year, something just as special, but on a much smaller scale, was happening here. It's Framingham. As you know, Framingham, 40 miles due west of Boston, Massachusetts. So all 5,200 town residents subscribe to regular health checks. There are now, I think there are 3 or 4 generations of participant. It's iconic. What did it tell us? It coined the phrase risk factor and how it maps on to important outcomes, heart attacks and stroke. Framingham has resulted in an average of 4 extra years of life. And they've had a huge impact from 5,000 people. But we can't look at data linkage in isolation. We've got to think about what health systems internationally are struggling with. And it is, to my mind, the rise of chronic disease. Chronic disease will cost the world economy $47 trillion over the next 20 years. The other big contextual issue is the global financial crisis. So the health service in the UK has to, in real terms, reduce its spending by about £20 billion per annum over the next 5 years. And what we're trying to do is to accelerate in the UK how we embrace health informatics and data linkage, computer science, in medicine at scale across the country. Funders have come together and coalesced around this issue at scale, pooled an initial investment of £19 million, had a competition, and awarded 4 health informatics research centres to undertake cutting-edge research and to build capacity. So that was the first investment. And these are the centres across the UK. Then another £20 million came along. So we have spent that money in the last 12 months on physical centres, creating accredited safe havens for data linkage. And we've called it the FAR Institute. So our 10 key activities as the FAR Institute are listed here. So Ian Buchan and John Ainsworth are based in Manchester. As you can see, they're refurbishing some very attractive Victorian buildings for health informatics research, and they're really leading on the methodology development. In London, this is Harry Hemingway on the right and Liam Smith on the left. Again, physical space, I think, is really important. Their cluster is really lucky because they collaborate with Oxford and Manchester on UK Biobank, but also Genomics England is fascinating. The other thing which we're linking into is the ESRC investment in administrative data research centres. And that affords us the intriguing possibility to create these networks at both the molecular disease and societal levels. So over to Wales, led by Ronan and David Ford. And what Ronan and his team have been really world leading at is liberating data for deep phenotyping and cross-sectoral data linkage. So again, a physical entity. What they're also leading on, this is Karina Jones, working with Sarah in Edinburgh, is public and patient engagement. And this is just so important. And this is an example of the collaboration with University Hospitals Birmingham, where data are linked in real time and fed back to users on the wards. And lastly, in Scotland, just very briefly, we're building on SHIP, which has been, SHIP's been a terrific collaboration. Again, we're investing in real estate. The biggest issue I've left till last, which is data governance. This is a challenge for us all. So we now have a duty to share, but also the notion of accredited safe havens. I would encourage this community that we need to look outwards, because this is moving at such pace. And an example I've chosen is the Global Alliance for Genomics and Health. So they've managed to muster support from 170 organizations in 32 countries. So the MRC and the Wellcome Trust have subscribed to this. And it's an international coalition formed to enable the sharing of genomic and clinical data. And what we're trying to do is move from silos to systems. So this is difficult, but there's huge opportunity in here.